Hello, and welcome to Grade.com Talks With. Today, we're talking with Kelly Dolan, President and CEO at Ronald McDonald House Charities, a nonprofit family and children's charity dedicated to supporting families with sick children in their time of need. And if you're new to our podcast, please press subscribe button either on YouTube or your podcast app, because today we're going to learn about an organization whose mission is to create, find, and support programs that directly improve the health and well-being of children and their families. Hello, Kelly. Welcome to Grade.com Talks. We're excited to have you here.
Thank you so much. So delighted to be with you.
Wonderful. Could you please tell us about Ronald McDonald House Charities for someone who is not familiar with your work?
Absolutely. So Ronald McDonald House Charities is a global organization. We are actually in 62 countries and regions, serving millions of children and families each year. The focus of our organization is to make sure that every child and their family have access to quality health care. We do that by helping with three core programs that we provide. Our Ronald McDonald Houses, which again are all over the 374 of those. And those are located either adjacent to or very nearby pediatric hospitals and healthcare systems, so that families can stay close as their child is being cared for. And we can talk a little bit more about the detail of those programs. But so that's the first piece of what we do. We want to make sure that families can get to and be at the most critical healthcare programs that their children need. So that's a real important piece of that access for children to healthcare. We also provide respite within the hospital systems. So we have Ronald McDonald House family rooms, which are located in the hospitals. So often, so many of our families have children that are going through long periods of stay at hospitals, and they're often in the NICU, and there are places where the families really don't have any privacy or a moment away from other people. And these family rooms really provide a great space for respite for them, and where they can still be very nearby where their children are in hospital, but that they have a moment to step away. And then very importantly, and we'll talk about this, I know, a little later, our Ronald McDonald Care Mobile program, which is our mobile health programs, again, providing the infrastructure in place for healthcare delivery to children in underserved communities around the world, both with access to information and education, to dental services, and even to vaccines. So that is really the purpose of the charity, is to really provide access and meaningful, compassionate care for the entire family as they are going through a child's illness.
Mm-hmm. When you mention meaningful and compassionate care, I think those are very important words. And what you're doing is very impactful in the areas that you mentioned. But making healthcare accessible for families and children is very important. And your organization is doing that not in one location, but you mentioned in more than 60 countries across the globe. And that's very noble. So I applaud your organization for doing so. You started as an organization, I believe, in United States, and you grow globally. Could you please tell us, how did it happen? How did you grow to be a global organization that is making healthcare accessible to families and children in need?
That is a great question. And when you just used the word noble earlier, it made my heart skip a beat, because really the nobility is in our force of volunteers, people who have come together in their communities to support families and children. And that is exactly how Ronald McDonald House Charities has been able to build and grow. We have, in a non-pandemic year, and we can probably get into that too a little bit later, we have an extraordinary average of about 490,000 volunteers that support our programs worldwide. So kind of wrap your mind around that for a minute and think about literally 500,000 people that support us, and that really is how we have grown. So we work, we identify, we do medical feasibility studies in the markets, and we take a look at what is needed in the marketplace for children and families that need care. And we work locally with hospital systems, but we really depend very much in the formation of our chapters locally on volunteers, and certainly volunteer leadership, our boards of directors all over the world that help us make the connections locally, that help us hire staff locally and build out for the specific needs of the community. So I think it's important that people understand that we don't, from the top down, impose saying we're going to absolutely expand in this area or that area. I think what has made us so effective as an organization over this, we started in the mid-'70s, is the fact that we are responding to community need on the ground, and we're building from there. So that's sort of a long answer to your question, but I think that's really been at the heartbeat of how we've grown and how we've stayed so effective.
It's incredible to see that you are uniting almost 500,000 volunteers across the globe. And those are just not volunteers, those are community leaders. Those are people who are passionate about issues surrounding sick children and families in need. And they are being advocates, and they are bringing other community members through the help of your network, through the help of your organization, to make sure the healthcare is accessible to underserved communities or just communities in general. Could you please tell us, what are some struggles families with sick children face?
You can only imagine, as you're sitting and listening to this, if you had a family member, especially a child, become critically ill or injured, the immediate need is access, as we've talked about. The immediate need is to be able to get to the best care possible. And so that's your immediate action. What comes with that is that your life stops, and that you are 100% focused on that child, and you're not thinking about at the time, you still may have other children to take care of. You may have other family members that you care for. You certainly, many have jobs that they need to attend to. And so everything from not remembering to bring a toothbrush with you to having proper clothes packed, any of that, you are just boom, life stops, and you are on the go, and you are right to whatever healthcare facility you can get to. That's the short-term need, is where we provide hygiene kits. We provide, again, a safe place for people to stay. But in the mid and longer term, you can imagine the expense involved, not only the healthcare expense, but all the peripheral expenses of, you now suddenly have to be eating at restaurants and getting food 3 times a day. You're not at home. You can't cook. You don't have, very often, if there isn't a Ronald McDonald House nearby, you are then having to pay for hotels. And you can imagine, hundreds of dollars a night. It's just cost prohibitive. So then very often the families have to make the very difficult decision to not spend as much time as they would like, and not be part of what we call family-centered care, where the family is at the center of the decision-making and the care around their child, because you simply can't afford to be there. So what we do is we provide that. We provide those immediate, we try to provide as much as possible those immediate needs. And last year alone, we saved families $772 million in out-of-pocket expenses. That is in their accommodation and food. So we try to take some of that burden off the family. Unfortunately, we can't help with long-term healthcare costs for their child, but we can help with those peripheral costs by providing these services.
Mm-hmm. Yeah, the struggles that families with sick children face can the list can go on and on. But as you mentioned, when there is a sick child in a family, the life stops, and at the
It
same
does.
time, then it comes a financial burden of finding a housing near the hospital, or finding meals, and the fact that Ronald McDonald House and other programs that you offer are being an assistantships to families in need in their time of need is very important. And the number that you indicated, more than 700 million US dollars to support in just a year, that's incredible amount. So what you're doing is, again, I really applaud you for what you're doing. You you mentioned in the beginning of the conversation again, as well as briefly, about Ronald McDonald's House and how it's located near the hospitals. But could you please tell us more in detail the purpose of these houses and what the journey looks like for families who come and stay in the house?
Sure, absolutely. So, we mentioned the practical piece of it, where we are providing accommodation and meals. Most of the houses provide actually 3 meals a day. Many of our house programs even provide snacks or mobile meals that families can pick up and take with them on their way to the hospital, so they don't have to come home, come back to the house during the day. But what we hear over and over again is a big piece of what our houses provide is a real sense of home to people at a time when they need it most. And we have communal meals we have volunteers, those volunteers that I mentioned earlier, that come in and actually cook meals for the families. And so the families can sit together in dining rooms and have a meal. We also have, in many of our house programs, separate kitchens that we call family kitchens, where families can stock their own food and they can prepare their own meals, things that might be comfort food to them, things that their other children may really be missing, so that we have smaller areas for those families to sit and just have a meal together. Again, giving them, and especially the siblings of these sick and injured children, a sense of home, a sense of calm that they certainly would not have trying to stay in a hotel room or with one parent one place, another parent another place. The other thing we have and provide is we have playrooms that are in our house programs, where children get to be children, and where they can play and have fun. And we have game rooms, we have family movie nights, we have our, what in some of the houses call our chief happiness officers, which are dogs. So we have dogs that are specially trained to be with children and families. And so those that are missing pets at home, even may have a dog to cuddle up with for a little while. And we also have extensive programs in some of our houses around education, where we certainly provide education assistance for the children and for siblings in a lot of cases that are going to be a part of a long-term stay, coordinating either with their local school system or with a school system in the area that they may have had to relocate to. So what we try to do is anticipate everything that a family may need. We have laundry. People don't think about that. We have full laundry services for folks. We even get the detergent donated when we can. So that everything that they are missing at home, we know we're not their home, but we are trying to make it as comfortable and as give them a sense of normalcy. I will add one more thing. One thing that they can't get at their individual homes, but they certainly get at a Ronald McDonald House, is a sense of community with other families that are going through similar circumstances. So while their children may not have the same illness or the serious injury, they are all one in that they're fighting through a very difficult, and in most cases, the most difficult time of their lives in taking care of their sick children. And that, we hear over and over again, bonds people. It bonds these families together, and many families stay in touch. with each other after they leave Ronald McDonald House, and it becomes a sense of community and support for each other. And that is just marvelous to me. It's really one of my favorite outcomes that we have in our programs, is that intangible, that ability to support people in a way that only they can do for each other. And we provide that setting for them to come together and have that sense of support. And it is truly remarkable.
Indeed, it's, as you mentioned, it's truly remarkable. But
Yeah.
what I really like about your approach is you're not building a facility just for the people to come and take care of their children, but you are building a home for them, home away from home. And for a moment, they can just focus on the family. They can focus on the bonding, again, within the family as well, within the community, rather than just focusing on their children being sick. Just it brings the family together, and making sure that there is a home feel adds takes away, I would say, a lot of stress away, and having a community around as well who are going through the same thing and can support you and can direct you is very, very remarkable, as indicated earlier. So I absolutely love your program, indicated Ronald McDonald's Houses, all across the globe. The second core program that you run is Ronald McDonald Family Rooms. You mentioned they are in the hospitals, but could you please tell us what those family rooms look like? How do the children interact within those family rooms?
The family rooms are really unique, and they vary greatly in size and scope depending on where we are, even throughout the United States, throughout Canada, throughout the world. Really, they can be quite intimate, and just basically almost imagine sort of a small lounge area where a family can be in a comfortable chair and a sofa, with a television and snacks. We always like, snacks and water, and just a place for them just to relax. We also have facilities that are quite grand, and that actually have napping places. We have little pods or little areas where families can take a nap. Some choose to spend that. We also have some where they can spend the night. Generally speaking, that would go into a house territory and not so much the family room, but we do have some facilities that have that limited as well. We even have facilities that have laundry. So again, while the parents are there, if they're perhaps not even staying at a house, but are there, they can do some laundry, come in and check it, and then go back to their child's bedside. So it is really, again, we listen to the local market. We listen to the needs of what that hospital system may want to have in their system, and also what we're hearing from the families that is most needed. And then we craft the program for that specific family room around that. I have to tell you, just as an aside, during COVID, we have had to close, or we did close, many of our family rooms because we have to abide by the hospital system's protocols. And we certainly 1,000% agreed with those protocols. And so what we were able to do, though, is repurpose many of our programs for the hospitals, and those family rooms were actually used for respite care for the frontline workers. So we had 115 Ronald McDonald House Charities programs that were repurposed and during the height of the pandemic, at the start of the pandemic in the first year, really. We now have transitioned back some of those, but we certainly have some that are still being used for that purpose, depending on what country we are in and what their status is with the COVID pandemic. So we are still in as you can imagine, as the world is in varied stages, and as they move from one stage and then maybe they backtrack and then they move forward, we are constantly advancing our programs relative to the country, to the community, and what their status is with COVID. So we have a very thorough reinstatement process for any of our programs, but we also, as part of that reinstatement process, we also have the backtrack, right? So we have, you can get reinstated, but based on numbers and based on the local public health focuses and guidance, we certainly are staying nimble in how we're doing that. So just as an aside, it was interesting how we were able to turn and repurpose those family rooms for different periods of time to be able to be part of the solution around healthcare writ large and not just our own program.
Mm-hmm. Wonderful. It's great to see that you're building family rooms tailored based on the needs of the location and of the specific hospital, as well as the based on the needs of families and children who are staying in those hospitals. So having a tailored approach, having a customized approach, and building those family rooms according to the specific needs is very important, and you're definitely doing so. And the fact that you were able to repurpose those family rooms during the pandemic and support frontline workers is even better. So have it not just being just staying there, but being a part of the solution is what your organization was able to do during this rough times across the globe. As we touched upon pandemic a little, I'm sure your the Ronald McDonald Care Mobile program must have been popular during this time. Could you please tell us more in detail about your Care Mobile program and how does it work?
Sure, happy to do that. So our Care Mobile programs, again, are very uniquely tailored to the communities in which we are operating them. So what we do with our piece of it is that, again, we work with the local healthcare community and we assess what their needs are, and then with our local chapters. And then we ascertain what programs would be most relevant for that community. And what we do is we provide the unit, we provide the mobile unit, we fund that, but then we work with a local partner, either a public health partner or, again, a hospital or healthcare system partner, or another nonprofit that would provide the actual services that are on the Care Mobile. So Ronald McDonald House Charities does not provide healthcare, but we provide, again, the access to it. And so we then work with the service providers in those local markets. So we have everything from direct pediatric health services that are deployed in Indonesia, in remote areas where it is very difficult for children to access care. We have a tremendous amount of dental services that are provided, again, in different areas where there is a lack of access to that type of care. And then we have a lot of public health initiatives around education, depending on what's needed in that area. There are some areas where there's we have a lot of education maybe around childhood obesity issues and wellness and education around nutrition for children and their families. So it varies a great deal depending on where literally we say, where in the world we are and what is needed. And that is definitely a program that we want to continue to build. Personal passion of mine in making sure that we can provide as much access as we can and for children, and that is an area. Now the downside of that is that they are very difficult programs to operate. As you might imagine, there's from an operational standpoint, they're difficult. You're going, especially if you're going into remote areas and staffing them properly, and the amount of work that's involved for the providers when you're working on a mobile unit and calibrating, it needed testing, and it's one of those that sounds great on paper, and you say to yourself, why doesn't everybody provide mobile health and all over the world, and it's challenging, and there's a reason why it's not as pervasive as we'd like it to be. So but we're not letting that deter us. We are finding ways to do it, and we are going to find ways to continue to expand it.
Yeah, I'm sure there's a lot of work that goes behind that is not visible to an eye. And you mentioned that making the purpose of your organization and one of the parts of your mission is making healthcare accessible. And Care Mobile program is actually making the healthcare accessible through your corporation partnership with service providers. And if you can imagine, like in remote, you mentioned remote areas in Indonesia or any part of the world, there are now hospitals around. There are, even if there might be miles and miles, hundreds miles away. And having such a service, Care Mobile service, come to the location, although serve a small number of people, yet very, very important service that is needed for the livelihood and for the health of children and families all across the world, especially in the remote areas. So what you're doing is very meaningful. I do understand there is a lot of work behind it, but I can see why it is of your passion, because it is making healthcare accessible to remote areas around the world. So that's wonderful.
And it's, and it's preventative, so much of it is preventative. And so if we can address these things up front, and we can do, extraordinary expansion of vaccination in areas where children do not have access to it. It's not a question of whether or not they decide they want to turn it down. It's a question, which is ludicrous. It's a question of that they don't even have the choice. And so being able to just to provide that basic preventative healthcare to children is just so critical. It's critical on so many levels. I mean, at its base, it's human. How can we not be doing this as a society? How can this not be? How can this not be a priority in our society to take care of the most vulnerable among us? It's fascinating to me and extraordinary to me that just isn't a given, and that this is not prioritized the way it needs to be. It's frankly shocking, but it is where we are in many societies around the world, and it's something that, again, with the power of community, with the power of convening people around a cause and a mission that is important, that is noble, that is the most human thing you can do, which is take care of babies and children. We can do it. We can absolutely do it, and we are doing it.
Indeed, you are indeed doing it, and you are doing it very impactfully across the globe through the help of, as you mentioned, volunteers and community members.
Yeah.
And if someone would like to support Ronald McDonald House Charities, how can they do so?
Best thing to do is our website, rmhc.org. If you would love to be a part of it, we mentioned nearly 500,000 volunteers. We certainly have every kind of opportunity you can think of. We have folks that come into our house programs and read stories. If you want to read stories to children, I mean, we have some restrictions right now, depending on the area of the world and so forth with COVID. But when we're fully back up and running, we have groups that come in and bake cookies in the afternoon for families. We have certainly people do the food program, making meals. We have gardens in a lot of our areas, and we have people that come in and do gardens and do gardening for us. So any of those kinds of things, we would welcome and love to have that support. Certainly all of our local chapters do major fundraising events. It's the lifeblood fundraising as for any charity. So if you wanted to get involved on that level and help us with fundraising, and absolutely positively, every donation counts. I cannot stress that enough. So if you feel that you don't have a lot of money to give, truly, we are so big and we serve so many people that truly every dollar that we get is needed and used. And we really run as a lean organization. We don't have a lot of overhead, again, because of those nearly 500,000 volunteers. So rmhc.org, and you can pick and choose if you want to support locally or if you want to support at the global level.
Wonderful. The link to the Ronald McDonald House Charities, rmhc.org, will be provided in the description. So you viewing and listen can go to the website and familiarize yourself with the great work Kelly and the team at Ronald McDonald House Charities is doing and support their mission. Thank you so much, Kelly. It was wonderful to get to know you and the very meaningful and impactful work that your organization is doing.
Thank you so much. I so enjoyed our conversation.
For you listening, if you enjoyed this conversation, please press like and share button because this will show the YouTube and podcast algorithm that this conversation is important, that we need to support families with sick children in their time of need. Thank you and see you in the next episode.